Did you know that sacroiliac joint dysfunction is the cause of almost 1/3 of low back pain? It's a common condition I see in my practice, and we treat it pretty successfully. The sacroiliac joints are the joints on either side of the low back. They transfer weight and forces from the upper body to the lower body. The sacroiliac joints move about 3 degrees when we walk and move, and when one or both of these joints loses that normal range of motion, it can cause dysfunction. Now, this leads to a perpetuating cycle of muscle guarding, joint restrictions, swelling and inflammation, and ultimately pain. The pain can be felt usually along the sacroiliac joint, kind of that bony prominence you can feel in your low back. It can also refer pain down into the buttocks, up into the low back, or sometimes down the back of the leg. There are a few causes of sacroiliac joint dysfunction. A common cause is repetitive strain or trauma. So falling on your buttocks or falling on your back can cause that trauma that can cause sacroiliac joint dysfunction. Other common causes are poor posture, leg length inequality or deficiency, an altered gait or walking, flat feet or deformed feet, and scoliosis. A few things that I can do in the office to help with sacroiliac joint dysfunction. We can prescribe some exercises to help you get to move better. We can do some myofascial release or stripping of the muscles around the area and the ligaments to loosen the tension that they're putting on those joints. We can find the joints that are stiff using a technique called motion palpation to find the joints that are locked up and need to be adjusted, and then we can provide that adjustment to get motion back to those joints. As well as stretching and in-office therapies to help bring pain levels down. Now I'm going to show you 2 quick stretches that you can do at home to help with sacroiliac joint dysfunction. First is the Piriformis Stretch. Grab the knee and ankle and try to pull it towards the opposite shoulder. I would do that both sides and try to hold for 20 to 30 seconds, 2 to 3 times per day. This is a great stretch of the piriformis and gluteal musculature. Next is the Lunge Stretch, which is a great stretch for hip flexors and great for any of you who sit for much of the day at work. Helps elongate those hip flexors, and for bonus points you can reach across to the other side. Those are 2 simple stretches I would recommend to help take a little tension off the sacroiliac joints and the pelvis. Thanks for watching. I'm Dr. Brown. I'll be putting more of these videos out in the future, so stay tuned and check it out.